Hello and welcome back to MLab 1101, Introduction to Clinical Laboratory Science. This is going to be part 2 of 3 for the first unit in Introduction to Clinical Laboratory Science. So let's talk about the organization of a clinical lab and where are clinical labs located. Well, you would most likely find a clinical lab in a hospital setting, possibly a clinic or a doctor's office, and certainly the Department of Health. They may have a different set of tests that they perform, and reference laboratories are also places you would find clinical laboratories. This image here is a picture of the Santa Rosa, California Community Hospital in Santa Rosa, California, where I was born, and this hospital no longer exists. So one of the first things to note about the organization of the clinical lab, not only where they're located, but how specimen processing, collection, and distribution of samples occurs. The first thing that occurs is specimen collection, which is, as we talked about in our last presentation, is usually performed by the phlebotomist. The specimen is collected, it is processed in a receiving area, and then distributed to its respective department depending on what type of test was ordered by the doctor. So this occurs by first going to specimen collection, going through processing, and then distributed to one of the departments, which we'll discuss one at a time in the following slides. So specimen collection and processing is the first collection of blood, urine, or microsamples. Blood collection is performed by the act of phlebotomy. Urine collection is typically collected by a midstream clean catch. It could also be collected by a catheter, which would be performed by a nurse, most likely, as well as other collection methods, but these two tend to be the most common. Microspecimens can be collected by swabbing a wound, possibly a nasal or throat swab for checking if the patient has flu or strep throat, as well as collecting tissue samples, which could also be set up for microbiology. The first department we're going to talk about in the clinical lab is clinical chemistry. Clinical chemistry tests the liquid portion of your blood and measures things such as electrolytes, hormones, or enzymes in your blood. Chemistry is usually connected to the serology department. They're also testing the liquid portion of your blood, although they're testing for immune reactions. This is a result of an antibody and antigen complex, and the presence of which can indicate disease stage such as HIV or hepatitis. The next department we'll talk about is clinical hematology. Hematology tests the cellular component of your blood. The cellular component of your blood includes things such as red blood cells, white blood cells, and platelets. It's typically done on an analyzer. We discussed in the history of clinical laboratory science in the last presentation that particle counters were repurposed for clinical use by counting cells using a technology called electrical impedance, and that's typically what is used by automated analyzers in the hematology department today. Next we have immunohematology, often called blood bank. Blood bank is the department in the clinical lab that deals with transfusion medicine. Blood bankers who work in the blood bank are responsible for identifying your blood type and cross-matching it to compatible units of blood and assuring that a negative reaction doesn't take place in the event that a patient needs a unit of blood. Our next department is clinical microbiology. Microbiology is the detection of pathogenic organisms. These pathogenic organisms could be bacteria, which would be tested in a bacteriology lab. It could be a virus, which would be tested in a virology lab. Mold and yeast could also be detected in a micro lab, which would be a mycology section. And parasitology, it could also be um, implemented in a microbiology lab, which is the detection of parasites. Our next department in the clinical lab is urinalysis. Urinalysis is, as the name implies, the analysis of urine. There's typically two ways of analyzing urine, and those are divided into macroscopic and microscopic analysis, and we'll discuss that in more detail in a presentation later on in this course. Next, we have coagulation. Coagulation is usually partnered with hematology. Coagulation is the study of the body's ability to form a clot. Measuring the body's ability to form a clot will indicate if a patient is going to have a prolonged bleeding time. This could be important if the patient is due to have a surgery or there's some type of trauma that there's a large amount of blood loss that needs to be controlled. Using a coagulation department, we can determine how quickly a person can form a clot, if at all, and possible inhibitors in a patient's blood that may prevent the formation of a clot. Really important to note is that who can order a laboratory test? Only a medical doctor can order a laboratory test for clinical testing. Clinical testing is used, as we discussed in the definitions, for the purpose of diagnosing, prognosing a patient. So only a medical doctor can order a test for these purposes. That's going to conclude the brief overview of the departments you may find in a clinical laboratory. We'll pick this back up with part 3 for the Introduction to Clinical Laboratory Science in the next presentation.